My name is Pauline. I'm a consumer advisor here at Monash. I grew up in the Mount Waverley area, and Monash Hospital was the hospital we attended as a family. I gave birth to my daughter in this Clayton Hospital. I now live out in Beaconsfield, and Casey Hospital is my local hospital there. And my parents, one of whom has now deceased, spent a lot of time here. My mum also comes here more than I'd like, but yeah, it is a hospital used a lot by our family. Yeah. Being a consumer advisor is about providing to the health service a perspective and a reminder of what it's like to be a patient, and providing information that's useful to help the hospital service improve. People don't come into contact with the health service voluntarily. People are unwell, people are vulnerable, and usually they want to get out as soon as possible, but it's an inevitable part of life that we all will intersect with the healthcare system, and I think it's really important to show compassion and empathy at these times. I think exceptional care begins with little things. So it begins with calling people by their first name. It begins with understanding that people have a life outside of the hospital, and they have talents and skills and a network of people and a career outside the hospital, so not reducing them to the status of patient. I'm probably looking at this particularly looking back at my dad, because when he died at the age of 85, the last 5 years of his life were really difficult. But he had had an amazing life before that. So he had a whole life experience, but in the health system, people's lives get reduced to something really small, and it's forgotten that, especially for old people, that they have a life outside the four walls, and we can all learn something from each other, you know, and I think everyone can learn something from patients too. Compassion is putting people in the context of their whole lives, and giving them credit for that. So, kindness is when people don't have to ask for every little thing. So it's not necessarily about anticipating needs, but we know what needs are. So I'm going to talk again about my dad here. So kindness is calling him Paul. Okay, kindness is knowing that because he can't walk and he's finished his meal and he's going to go to bed, that he'll need to clean his teeth. And having to ask for things all the time when you're got a fully functional brain and the only thing that's not working is your legs, it's very exhausting to ask for every little thing. So to be provided with the necessary things and to be called by first name, that goes a long way towards it. Another thing is communication. Now, everyone has different styles and different ways of being, but I think you have to get to know, especially again, long-term patients. So for someone like my dad, he's someone who was never late to anything in his life, and so time was very important, and I think there are a certain cohort of people that operate like that. So I remember when he was in care and someone said they were coming to see him at 12 o'clock to take him to wherever, you know, some appointment or physio, whatever it was, and they didn't come at 12. And by 12:30, he was just about losing it. So it's not that that's his style, to be punctual and on time and to care, you know, to know what cares to someone. All it would have taken was a phone call at 12:05 to say, Paul, I'm really sorry, we're going to be a bit late. This is about keeping people informed, calling them by their first names, seeing them as a whole person, and doing things without them having to exhaustively ask for every little thing, you know. They've got a runny nose, get a tissue. Don't wait for them to ask for a tissue.